second look at Aspirus' decision to pull its emergency services from its Ontonagon hospital. John Truitt breaks down how people in the community learned of the news and how local leaders tried, so far unsuccessfully, to get Aspirus to change its mind.
This past winter may have been a mild one, but in Ontonagon, a storm was brewing. Ontonagon County emergency officials tell us they first started hearing about the possible closure of Aspirus Ontonagon Hospital over the winter. They say employees were questioning whether to purchase property or make long-term investments in the community, having known for some time that their hospital was underperforming. These rumors got the attention of the sheriff and the emergency 911 director, Mike Coker. Well before the closure announcement, Coker's calls to Aspirus were not being returned until Coker asked for State Representative Greg Markkanen to intercede. Coker says Aspirus then told Markkanen, along with Ontonagon Sheriff Dale Rantala and Coker himself, that the rumors were false.
We were told that that was a bad rumor and we ought not spread that. 5-6 days later, after we had one of our elected officials call Wausau Aspirus to ask about that rumor, he was also told that it is false. Ontonagon will not close. 5-6 days later, we all officially got the notice that Ontonagon would be closing within 60 days.
Announcing the permanent closure of Ontonagon's emergency department just days after assuring everyone that it would not close does not sit well with lawmakers and local officials. I caught up to State Senator Ed McBroom on his way to work in Lansing. He says lawmakers were misled.
As little as 2 weeks prior to the announcement of the closure, they urged you not to proliferate any rumors, as they called it, that the hospital would close.
Well, as a matter of fact, Representative Markkanen spoke to them less than 4 or 5 days before the closure announcement, and they assured him that it wasn't happening. So it's really very frustrating because they clearly were lying at that point. They have not been acting in good faith at this point.
The announcement of the closure in part reads, quote, "In addition to the improvements to Aspirus Keweenaw Hospital, Aspirus will transition Aspirus Ontonagon Hospital to a rural health clinic, which will provide services that better match local needs in a community that has changed dramatically in recent years. Effective April 20th, 2024, hospital and emergency services will be replaced by a robust suite of outpatient-only services the community depends on. Currently, Aspirus Ontonagon Hospital serves just one inpatient a day on average. Some days, there are no inpatients." End quote. This press release was the only information released to the public and was taken down from their website soon afterward. No further comment was ever given. Local 3 has reached out to Aspirus dozens of times for their input, with no luck. They have never gotten back to us. According to State Senator McBroom, Aspirus was in a tough spot when it came to their Ontonagon property. As the press release indicated, the hospital was underperforming due to dwindling patient numbers and the high cost of bringing in doctors and nurses to staff the emergency room.
I understand some of where Aspirus is coming from a completely practical standpoint. They can't run it for free. And there are many days where the hospital didn't see people, the emergency room didn't see people, and they were spending nearly $2 million a year on flying doctors in so that they were available. So I understand it was a difficult situation, but why did they continue to tell everybody they were going to do a big expansion there? Why couldn't they have done some additional notifications? What about stretching out to this new federal program for rural emergency departments? When we finally did manage to have a conversation about this, and Congressman Bergman was able to get them to the table, all they told us was, well, we're not eligible for that. But they didn't really provide us with a lot of understanding of why they weren't. And certainly Congressman Bergman would have been open to, well, what changes do you need to see in this so that you would be eligible? But there didn't seem to be a genuine interest at that point. So it's very frustrating because I want to be understanding of the impracticalities they were experiencing that drove them to this, but they never operated as a partner. They never reached out for any partners, whether it was in the community, the state, or the federal, to help figure this problem out. It's just simple, here, take it. This is what we're doing. And this is what's really frustrating, particularly in light of some of the economic activities that we seem to be on the cusp of with Highland Copper and White Pine. To not have this facility there able to take care of people is a major hindrance towards future economic development in that area, as well as just a hindrance to good overall health care for the people who live there.
What's at issue is the abrupt turnaround of Aspirus's commitment to Ontonagon. Just 2 years ago, Aspirus pledged $15.8 million to build a brand new hospital and emergency room in Ontonagon. The pace of the closure, giving only 60 days notice of closing, the lack of communication, and the denials by Aspirus when asked if a closure was imminent. 4 weeks after the announced closure, after repeated attempts by local officials to set up a meeting with Aspirus fell on deaf ears, U.S. Congressman Jack Bergman stepped in and began appearing on the written request for a meeting. Sure enough, Aspirus was then willing to set up a meeting with Sheriff Rantala, Mike Coker, and the president of Aspirus's UP operations. The meeting yielded very few answers. However, when asked about the denials about closing, according to Coker, Aspirus said the decision to close the hospital was made the day before the announcement, on a Sunday. Another question that was answered was why did they not seek REH status, or Rural Emergency Hospital designation, a federal program designed to assist rural hospitals in keeping their emergency rooms open. Aspirus claimed Ontonagon Hospital did not qualify for this program, but failed to explain why. And so Ontonagon is left without a critical care facility. A lot more questions, no real answers, a frightened community, and an hour's drive to the nearest emergency room. A ribbon of asphalt filled with uncertainty. In Ontonagon, John Truitt, Local 3 News.